Thank you, Dr. Cynthia. Welcome for the invitation. Thank you for the board of the Academy. I'm come from Venezuela, Caracas. And I'm going to show my experience, or our experience, my group, doing that kind of procedure. I'm a spine surgeon, still doing surgeries in the spine of my country and South America. But this is one of the procedures which we're doing in Venezuela, mainly in young patients and middle-aged patients as well, with that kind of pathologies. I'm an orthopedic surgeon, as I told you, and actually I'm the president of the Venezuelan Comprehensive and Regenerative Ozone Therapy. It's vinculated to the main university in Caracas, which the name is Venezuela Central University, and we're working with the medicine faculty, running one important diplomate in Venezuela, mainly for doctors, specialists. We had to learn from the best. Here we have Dr. Belio Bocci, passed away many years ago. And this is Dr. Gabriel Taurachi, who is running the main diplomate ward in ozonotherapy in Verona University in Italy. You will hear something important from this gentleman and with our experience doing ozonotherapy in the spine. As you know, I'm going to be running fast because of the time. The ozone is a combination 95 oxygen and 5% ozone properly. It's been obtained through special generators who make you able to get the normal concentration you have to use in different procedures. Was used in the World War I to cleaning and disinfection wounds. This is very important gas which produce that kind of effect with some kind of material, for example, latex wall. Destroy that material, in fact. We have done the ozonotherapy in some procedures, infection, trauma, tumor, etc. But we're concentrating about for disc herniation to show you how the ozone is helping people. The lower back pain can be induced from procedure, for example, rods outside of the point. But 67% of the world population may affect at some point of the life. You can have some low back pain in one time in life. This is very important. Sometimes it's important, sometimes it's important, but sometimes it's accompanied with that kind of problem, the disc herniation. This is a big problem. So the most common condition in this area are mechanical lower pain, as I said before, but we're treating lumbar herniated disc, arthritic spondylosis, this disease, when the disc lost the height. Another of the direct causes like failed back syndrome, and many patients with 2-3 procedures before. This kind of patient, respond very well with the ozone therapy. Just to remind, we have very important cause of the pain. This is a mediator, chemical mediator. It's coming from has been called like a neurotransmitter because this has been released for special enzymes. It's in the synapses area. They will take the information, go straight to the brain will send the information, take the arm and pain, I am able to go, I'm able to walk, etc., etc. But the more important thing here is the chemical substance can be transported inside the axon here of the nerve root and initiate the production of inflammatory processes like the prostaglandin. This is the more important substance released here to the mediator. And this is going to be our goal, by all means. So, something to remain. 80% pain in the back, the lumbar herniation, 90%, mainly in young population and middle age, as I told you before. Many procedures have been done, surgery including microdiscectomy, foraminoplasty. Right now we're doing endoscopic surgery for the foramen to take out the herniation. But the ozone injection therapy is a very important and conservative alternative who is helping right now people with that kind of problem. Unfortunately, here in the United States, it still hasn't been approved. that procedure, but all around the world, we are doing that kind of procedure. We obtain the ozone to this way, and I will explain you how does it work. The etiology, I saw before, multifactorial disease, biomechanics, bad procedure, bad movement, biological, still in studies, genetics, pathogenic, decrease. When I say genetics, it's because we take one group in Indians in Venezuela. We have a special customer. They don't use shoes. They all the time in kneeling position. And we could compare this on the magnetic resonance, MRI, with another group, the normal population. Those Indians don't have any problem in the disc. It's very interesting. So genetics is one very important point to be taken account. Biomechanical alteration of the spine, metabolic, this is the cause. Yeah? The benefit of sonotherapy could be explained by decomposition, I said before, and inducing the human body. Well, again, the ozone, starting the material, the ozone can stimulate the oxygen metabolism, activating the immune system, and influencing the wound healing too. This is being demonstrated mainly in diabetic foot to avoid the amputation of the limbs. There are many studies around. Probably the ozone, through the direct stimulation, release nitric oxide. It can induce a vasodilatation. This is going to help because the hypoxia in the area is very important, and it's one of the causes of the pain as well in the area. Given its anti-inflammatory or antioxidant property, the ozone may reduce the inflammatory status in the area that characterizes the lumbar disc herniation. Here is very important as well something to take in account. Because the older age and comorbidities not suitable to surgery. So this is going to be very good patient to be treated with that kind of procedure. And you can go in as well. This is procedure and protocol of Tabarachi, one of the I mentioned before, who practice paravertebral injection of ozone with very good results as well. The same thing, just to remind, alterations of biomechanical properties of the disc structure, impingement of the nerve root, the cascade of the pain started here. Second, stability of the nerve, and then as before, for release of chemical mediator. The ozone is going to be one of the more important tools to be used here. Just to remember you, this is pulpus, the nucleus pulposus of the disc, going through when the annulus is erupted, the nucleus pulposus is going through the disc to the annulus, and impingement, the nerve roots, and start the pain, and start the problem, and start the incapacity. So the prolapse of nucleus pulposus, straight ahead to the nerve root, and the problem starts. Some causes as well. Second, the loss of the structure. In the degenerative disease of the spine, you can see so many osteophytes. Sometimes it's very difficult, but in this area, the paravertebral ozone in older patients help a lot with the pain. Make the patient more suitable to go ahead with the daily life. And this is another case I'm going to show in the MRI, and what you have to do in this one. So, problem with the disc, herniation, or degenerative condition of the spine for this patient. This is some things, just to remind again, the mediator, the neurotransmitter, how the pain is going on. But it's very important, because here in this area, there is a very important enzyme, which is the phospholipase A, which is the very important thing that is conducing to the pain in the area, phospholipase A. But this one, phospholipase A, mediate mechanical hyperalgesia, induce the production of the vast majority of the chemical pain de facto mediator. But the ozonitric, the nitric oxide, inhibit the mechanical hyperalgesia because increases the oxygenation of the area. This is some of the enzymes who are present when we inject ozone in the area. The third one, the concept of the local chemical mediator of the pain in injury tissue has gained greater support, definitely is for enzymes. And this is the point that the ozone is going to act, trying to diminish in very important amount this kind of substance. The application of ozone injection, also known as ozonotherapy, has been employed in young patients, as I said before, when the degeneration may not yet have been accompanied with this degeneration. It's going to help a lot. In our patient, in our cases, this is the more important population visit our clinic. Even in a retrospective study observed no immediate sign of the disc and plane degeneration 3 years after the ozone therapy. This aspect need to be taken in consideration when performing intradiscal injection. There are two different pathologies. Just to remember how the ozone act. Intradiscal the ozone act in 3 different levels. Inhibition of the prostaglandin 2 and phospholipase is very similar to the action of the steroids, but without the side effect. Another pro-inflammatory cytokine, interleukins number 1, 2, etc., and interferon A, increase the release of immunosuppressive cytokines, the interleukin 10 and the factor B1. So that's conducive to a very important analgesic and anti-inflammatory effect in the area when you have been injected the ozone. It increases as well the local microcirculation because reduce the venous ecstasis that conduces to analgesic effect, and the nerve root is very sensitive for the hypoxia. So when we increase the oxygenation, the release of the oxygen nitric, this condition is going to be an improved area. It's a direct effect of some mucopolysaccharides and proteoglycans. This is the more important substance as well in the nucleus pulpus. And this is the ozone is going to act when you see the video, so I'm going to show you later, which is called the ozonolysis. When the ozone put inside the nucleus act against these proteoglycans through the ozonolysis, producing chemical discolysis with water loss immediately, and dehydration. That conduces to a very important reduction of the protrusion. Of course, the pain is gone, and later on you will see in 5 weeks' time how the ozone will finish the work there. Subsequently, he says, a degeneration of the matrix occurs, which is replaced by collagen fibers in approximately 5 weeks, resulting in a reduction in importance of the volume of the disc. It's mummified. Practically in 3 months' time, the disc and the nucleus pulpus is going to be mummified and never will back the herniation again. Never. I'm going to show our protocol. I know that there is many different protocols around the world. But it is our experience since so many years, and I'm still doing, and every day, of course, we try to improve more. So, paravertebral injection, intradiscal injection, I told you before, activation of cell metabolism increases the chemical mediator. Yeah, we're talking about that. Cervical and lumbar disc herniation, grade 1 and grade 2. This is very important when we have to talk about the inclusion patient, because non-extrude post-surgical fibrosis. So very important, do the ozonotherapy or the discolysis or nucleolysis in contained disc herniation, because we need to go straight ahead to the nucleus. Facet joint syndrome, this is going to be helped as well when we do the paravertebral injection, vertebral degenerative condition, and some kind of modern lumbar stenosis. This is a mechanical condition. Here I have a video, Tony, just to show you how this one start. Here, the compressor nerve. Oh, it's okay. Okay, again. And the free nerve. This is the action of the ozone. Next one. Okay. Here the ozone is acting, then the root. Okay, reducing the volume. Minimal expression, free nerve root. Next one. Okay, bien. So, as you told before, almost 80% of the Western population experience lumbar pain. The more important thing to go to the exact diagnosis is try to have very important tools in your right hand. So we need some kind of special evolution, like a dynamics X-ray, CT scan, MRI, arthroscopy sometimes, electromyography, and other kind of systems which are going to help you to go to direct and exact diagnosis of the patient. Very good evaluation, clinical evaluation. The neurological exploration is very good. And when we have both, we are going to go to the exact diagnosis. I'm going to select the proper patient to go ahead. So we can avoid mistake when we're going to have in our hands very good diagnosis helping with that instrument. So inclusion and exclusion, this is very important. So in cervical and lumbar disc herniation, grade 1 and 2, production no extruders, as I told you before. Post-surgical fibrosis, facet syndromes, musculoalgia syndrome, so it's like a problem I'll have because I'm going to show as well how sometimes one disc herniation can induce very important algia in the area. How it disappear when we have later the in MRI to compare before and after before. Vertebral degenerative arthropathy and myelomodular lumbar stenosis. This is inclusion area. Don't do ozone therapy or disc herniation when you have extruded migrate. You never will go to the nucleus pulpus. It's impossible. When you have severe spinal stenosis, you have to go to surgical procedure, and when you have severe instability, like spondylolisthesis, you have to fix the spine to correct that problem. Our procedures, percutaneous intradiscal ozone therapy injection. Some people used to call this discolysis, but the discolysis is not really the proper name, because the disc is composed of the annulus and the nucleus pulpus. You are not going to act in the annulus, in the ring. So you are going to act exactly in the disc. Also, in the treatment of the herniated disc, it's a minimal invasive technique, and it's based on the injection of the ozone, both at the level of the herniated disc and the paravertebral muscle. The ozone injected into the disc accelerates the degradation, I told you before, of the polysaccharides in the nucleus pulpus, thereby decreasing the volume of this is the goal, decreasing the volume of the native material. And this is what we're going to look for. It's very simple. The patient goes to the operating room after proper diagnosis. The discolysis is from here, is performed under sedation. And a couple hours time is discharged. It's very good for the hospital, low cost, no problem with the admission. The patient walk and see the difference couple hours time before and after we have done the application. And after that, we used to apply 4 or 6 applications in paravertebral, following the Tabarachi protocol as well, in outpatient session. And 1 year after, we used to take another MRI to compare after and before the injection. This is our experience using the C-arm. Some people look in the practice of the discolysis. We use special as well proper generator to be sure that the concentration of the ozone is the proper concentration we need for the patient. So there are many generators around the world, but we have done with this one very good. Okay, run this video. We are going to select in the C-arm the proper area. This is 45. Mark subpercutaneous point when the needle is going. Okay, this is 45. Next, run. Okay, next one. Okay, we're going to with this needle to go to try inside. We're going in the adequate area in 45. We're sure about that. You feel when you are starting to introduce the needle, like you went to the paper. You feel exactly, oh, I am in the area. Perfect. I feel my finger. Next one. One I have done, never cross to the middle area. The ozone is here. I'm going to center my imaging. Look at what's going to be here. Ozone, please. Here. Whoop. Piston area, okay? The immediate action here. Next one. Here is one area difficult in phase 1. Sometimes allowed to go through. If not, I will show you. This is ozone injecting. Look at the action of the ozone inside the disc always. starting the action exactly again to the nucleus pulpus. Next one. Next one. Okay. This is the case. Aveledo Indira, this was done in 2014, but huge herniation, okay? And this is important disease as well starting. And the axial, you can see in the left side, huge hernia, but it's contained. It's not migrated, it's contained, okay? So we proceed with ozone therapy in this area, in phase 1. You can see Indira, 1 year after, no herniation. Gone. Okay? Probably this lady will need later another surgery because there is some modic change in the vertebral body that probably is going to cause different pain in this patient, but later on. Here another case. This is them in May and January 2011, okay? Molina Martinez. Huge block here in between the phase 1. Look at this area, this pain. Because the mediator, chemical mediator, with huge pain in muscle area and this adjacent area as well. Look at the herniation here, okay? And also, 1 year later, here is Martinez Moya, 2012. Free of pain, free in the channel, and very, very, very light. Still herniation, but without pain at all. If you can do phase 1, because the iliac crest is going to be one kind of impediment for you, okay, use the TAC. We take the patient with local anesthetic in this area. We go straight with the needle to the foramen and inject the ozone in the foramen. And here is, after we return the ozone to the foramen and into the canal. Okay, we didn't went to the nucleus pulpus, but we're reducing the pain with the mechanical condition I explained before in the foraminal area, and after that we combine with some paravertebral injection. This patient don't need really any kind of surgery later. Here is, run this one, please. We use as well for degenerative disease and low back pain the combination of PRP plus ozone with this method. Okay, we're mixing here the PRP, the ozone was inside. I use 30, 40 micrograms of ozone, mixing this amount of PRP, and after that, inject in paravertebral area, in the area we had identified when the facet joint with the near area of the lamina and in the muscles area as well, to avoid the problem I showed before, show it in the MRI. Next one, okay. This is my paper published in Europe, which the name is the practice of the discolysis percutaneous in medical ozone and pathology. You can go to the MedPub and you will see this paper published in Europe. This is our result. I use also the disability index. You can see the difference after and before when I use this ozone. 10%, 30%, 58% in comparison after or before we had done ozone in mild, moderate, severe disability. Look at how the recovery disability is from 58% to 10%. This is a special questionnaire that the patient fill. I don't feel that same by myself. This is paper is coming from the patient. Each patient has been treated with ozone. This is the similar degree, but showing different progression. This is very important as well. The results, 10% pain to 1, 30%, good, look at one, 58% to 10. This is very nice procedure, definitely a very conservative and very productive procedure. So, once more, the also the disability index test, you will see in this point, how they improve. How they improve. And after that, we continue some important protocol, mainly in this disc degeneration or lower pain. We used to practice this protocol, 6-8 sessions every 2 weeks, then weekly for 3 weeks, finally monthly up to 3 months if needed. Most of the patients definitely improve with this procedure in 2 or 3 months' time. This is our case suite right now, 308 patients, good to excellent, reported recovery in quality of life, all of them successfully returned to the normal day, and all the patients say yes. If you will repeat oxonotherapy, yes, I will do. This is my book. This is the Professor Bello Bocci book. This is my book. It's in Amazon. You can go ahead with both of them, and you will see the newest knowledgement in ozonotherapy in the spine problems. So, does the ozone help? This is the question. Thank you very much.